question, can we treat cannabis dependence? We wanted to get a sense of the challenges that cannabis-dependent individuals were up against when they presented for treatment. So we recruited two groups of volunteers. One was a group of young men and women who were dependent on cannabis, and another was a group of very similar young men and women who did not use cannabis or other drugs. And they were equivalent in terms of their age, their IQ, their level of education, and the proportion of men and women in each group. And we studied them over a 28-day period when no marijuana was used. And this is enough time for marijuana and all of its metabolites to be eliminated from the system and for acute withdrawal from marijuana to be completed. And we looked at the groups in terms of symptoms, brain chemistry, neuroimaging studies, and neuropsychological functioning. And what we found was in the group who were dependent on marijuana, and these are daily users in their 20s, compared with the group who was not dependent, even after withdrawal was completed and no marijuana had been used for 28 days, there were still a lot of symptoms of craving for marijuana, sleep disturbance, mood disturbance such as anxiety, dysphoria, irritability, restlessness, and feelings of fatigue and problems with concentration. So there were a number of symptoms that the cannabis users had after being abstinent relative to the non-cannabis users. And in neuroimaging studies, when we showed these groups pictures of marijuana leaves or houseplants or salads, the brain activity of the cannabis sample would get very activated in response to pictures with cannabis cues in them relative to the non-cannabis cues. Whereas in our group of non-drug users, they would be very interested in the salads and not at all interested in the cannabis cues. So even after not having cannabis and completing their withdrawal from cannabis for 28 days, the cannabis dependent sample still had a heightened awareness and response to cannabis cues. And they also had lower levels of the chemicals in the brain that activate the fight or flight response, like cortisol, for example, that might be helpful in resisting cues associated with cannabis use in their environment. And finally, there were still deficits on neuropsychological tests and what we call executive functions, which include the ability to inhibit acting on impulses, making good decisions, sorting through more complex types of information. So these are some of the challenges that people with dependence on cannabis bring with them after they've completed withdrawal from cannabis. And there are no approved medications for marijuana dependence, and behavioral therapies rely on intact cognitive functions. They don't make allowances for these problems with processing complex types of information that we see in the cannabis dependent sample. So we thought about what type of intervention might be helpful for individuals with this profile of challenges. What might help them withstand some of these challenges and not relapse into cannabis use following withdrawal. And preclinical researchers have shown that marijuana withdrawal dysregulates the balance between brain stress systems such as corticotropin releasing factor and anti-stress systems like the GABAergic system, and particularly in the extended amygdala, a structure in the brain that's very much involved in drug addiction. And another group of preclinical researchers, Marissa Roberto and colleagues, have shown that such GABA-CRF dysregulations can be normalized through the use of gabapentin, which is an relatively old off-patent medication that was originally developed as an anticonvulsant and is approved as such in the United States and also as a treatment for neuropathic pain. But it's also been used off-label to treat mood and sleep symptoms, which of course are of interest in people recovering from cannabis dependence. And in a sample of normal volunteers, it was shown to improve certain areas of cognitive functioning a little bit, but still areas that are relevant for cannabis-dependent individuals, such as those functions involving learning, memory, and some aspects of executive functioning. So we undertook a randomized controlled trial of gabapentin, which was given 1,200 milligrams a day, or identical placebo capsules in 50 men and women with cannabis dependence who were randomized to receive either the gabapentin or the placebo for 12 weeks of treatment. They also received weekly individual behavioral therapy that was oriented to helping them remain abstinent from cannabis. And what you see in the bars are the self-reported amounts of cannabis used at each week over the 12-week treatment period, as well as the first 2 weeks before treatment began, which is labeled as week -1, which is how much they were smoking in grams per week coming into this study, and week 0, which is the time that the treatment period began. The lines are the amount of THC, the psychoactive ingredient in cannabis, that was found in the urine. So we had 2 measures of cannabis self-report and then the urine determinations. And in both cases, you'll see much less use of cannabis over the 12-week study in the gabapentin group, which is denoted by green relative to placebo, which is the blue lines and bars. In fact, the urine showed no new cannabis use at all for the last 4 weeks of the 12-week study in the gabapentin group. And when you look at the symptoms of withdrawal, which is in the top left-hand chart, you can see in the first 4 to 5 weeks of the treatment study, the placebo people in green were experiencing a good deal more withdrawal symptoms than the placebo-treated subjects. And that was also true for specific measures of sleep in the upper right-hand box, craving in the lower left-hand box, and mood in the lower right-hand box. So in conclusion, what we found was that relative to placebo, gabapentin significantly reduced cannabis use, withdrawal symptoms, and specific symptoms of craving, sleep, and mood, and it also improved the overall executive function. And these reductions in cannabis use and withdrawal symptoms lend support to the efficacy of gabapentin as a treatment for cannabis withdrawal and dependence. And these positive findings for gabapentin lend support to a neuromodulatory approach as an alternative to the agonist or antagonist approach to the treatment of cannabis dependence that often characterizes pharmacological approaches to drug addiction.